Good evening and thanks for joining us tonight on Good Question. My name is Travis Coffman. I'll be your host. For years, Guam has struggled with the size of its only hospital, particularly in the area of the emergency department, the intensive care unit, and the critical care unit. Too many patients, not enough beds. They've done the best they could, but that is going to change. In fact, tonight on Good Question, we are going to meet two of the women that have done the best that they could to work under cramped conditions, and they're going to tell us about how the expanding hospital is going to help them expand services to people all over Guam. Thanks for joining us tonight on Good Question. When we come back, we've got Suzanne Aquino and Marnette Aggabao, both registered nurses, and they'll be joining us here on the program. Thanks, ladies, for coming out tonight, and we very much appreciate you being on the show, and we'll get started right after these.
Fox 6 takes Guam's #1 rated news and talk radio station, News Talk K57 to TV. Watch Fox 6 every weekday as our PNC cameras feature the live in-studio environment of The Breakfast Show with Ray Gibson, Patty Arroyo on the radio, and The Big Show with Travis Coffman on News Talk K57. Enjoy an entertaining televised look at Guam's most popular talk shows. Tune in to Fox 6 every Monday through Friday from 6 to noon, and then again from 4 to 6 to see what's on the radio.
Help make a difference in our community and join the fight against crime. Tune in to PNC News every Wednesday night at 6 on ABC 7 and on Fox 6 at 7 p.m. for the Guam Crime Stoppers Crime of the Week. Each week, the Guam Police Department will highlight an unsolved crime, hoping you may have information relating to the case. Join Crime Stoppers Coordinator Officer Paul Tapao every Wednesday night on PNC News for the Guam Crime Stoppers Crime of the Week.
Good evening and thanks for joining us tonight on Good Question. My name is Travis Coffman. I'm your host. Tonight we're going to talk about the expanding hospital. For years, folks have gone to the hospital, more folks than there was hospital, particularly in the emergency department and the intensive care unit and the critical care unit. And that is changing. We've got a big ribbon cutting this month, new space, new rooms, and there's more to come. And not working in the hospital, we're not exactly sure how that is going to affect patient care. So we've asked a couple of experts to join us on the program tonight. And these ladies are nurses. They are the head of the respective departments. We've got Suzanne Aquino. Suzanne, welcome. Thank you very much for coming to the show. She's the supervisor of the hospital's emergency department. And we've got Marnette Aggabao, also registered nurse, and she is the acting nursing supervisor of the critical care unit and the ICU.
Yes.
Thank you.
Tough job, absolutely. We're glad to have you here. So let's start with an easy one. How long have you been at the hospital? Let's start with you, Suzanne.
I've been here since 2001, so 12 years.
Okay, so you've had 12 years of working in the emergency department.
Nowhere else.
Okay, and how about you, Marnette?
I've been here since 1995.
Okay.
Yes, so it's like 29 years.
Oh my gosh.
At Guam Memorial.
Holy guacamole. Well, let me ask you this. Let's just pretend like this expansion wasn't taking place. There was no extra beds at ICU or the emergency department. What would be the day-to-day situation at the emergency department?
Well, our space is really limited, so some patients sometimes are in the hallways waiting to be seen, waiting for a room to be admitted to. And of course, that's less privacy for them. But we can only do so much considering the space that we have. But we're doing the best that we can.
Now, when you say limited, how many beds are there in the emergency department?
Currently? Okay, so we have 1 trauma room for now, and I have 8 monitored beds, and then the hallway beds if need be.
This is going to sound like a crazy question. I mean, we've all seen sort of medical dramas and stuff, but what happens in the trauma room?
Patients that their heart stops beating, stops breathing, any other trauma cases, accidents, drowning.
Oh, okay, so the most serious of the emergencies
yes,
that
definitely.
need the most attention right away. Okay,
right
and then
away.
the other emergency beds, what are those used for?
They're used for monitoring patients that are having chest pain, having hard time breathing, having seizures, definitely. Other Other serious cases, like they're having a infection that is going on for a long time, and that compromises their airway also.
Okay.
Yeah.
So that's what's happening
Basically,
at
the ABC issue, airway,
ABC?
breathing, circulation.
Airway, breathing,
Yeah.
circulation.
Yeah. Most
That's
serious
gonna-
patients goes in the other beds,
Okay.
the other monitored beds.
Got it.
Yeah.
So let's say things go well for you in the emergency room. Do you automatically go to ICU next, or where do you go next?
Well, that depends on the diagnosis. That's why we do a lot of testing, CAT scans, X-rays, blood tests, and then we go from there. So patients needs telemetry beds, goes to 3rd floor. ICU for now will be in the 1st floor, but then they're transferring soon, so it's going to be the same floor, 2nd floor, or regular patients that are not as serious as what the case may be.
Okay. Now, in the emergency department, as it stood before any improvements, on average, how many people would you have in the hallway that you didn't have room for?
Okay, the worst case is we're going to use the
Yeah,
hallway
the worst case
radiology.
scenario.
The worst case is we use the hallway radiology. So that's going to be like really overfull. That means that we're in code red situation, no other space because upstairs is also full for admitted patients.
Really?
Yeah, so it's a mix of admitted patients waiting for beds and patients that are waiting for disposition, meaning can they go home or do they need to stay?
Oh, I see.
Yes, and we also have the ER annex that we use in case patients are waiting for telemetry beds, surgical beds, med-surg beds, and sometimes ICU beds. So we try not to put patients that are seriously ill.
Okay.
More
but
stable patients.
But I mean, the need clearly is there.
Definitely.
The need was clear that you absolutely needed some improvements, some more space. All right.
Right.
So there's the situation at emergency department. Now let's head on over to ICU. We've got Marnette here heading up ICU and critical care unit. What happens in ICU? What happens in the critical care unit?
ICU, we take care of patients that are on life support, trauma patients from the emergency room. We have medical patients that are very, very, very sick. You know, we take care of them. Patients that have a lot of medications to help them with their blood pressures. And also patients that are on hemodialysis and needs to be monitored.
Okay.
We have them in the unit.
So without any improvements, how many beds do you have there?
As of now, we have 8-bed capacity, and some of the patients that are admitted in the intensive care has to stay in emergency room for now. Yeah, if we are full by 8.
Oh, I see.
Yeah, so they have the load of our work in the emergency room.
And they're already overcrowded.
Yeah, they're already overcrowded. Yeah, so now we will have the 14-bed capacity, but with the staffing that we have right now, we're only good for 8 until we recruit more nurses on specialized area.
Okay, so
Yeah.
even with the extra room, you're going to need more people
More
to take
people to
care
take
of,
care,
of
yes.
more beds. Okay, if you're just joining us on Good Question tonight, you're wondering what we're talking about. A lot of things in the news this month about expanded ICU, CCU, and expanded emergency department at GMH, and we wanted to talk to some people that had a little experience there, and between them, they have more than 30 years of experience at the hospital. So if there's anybody that would be experts on this particular program, these would be them.
Yes.
So now that they're going to start with, there's two things. There's a small, or not small, but a modest sort of increase in the emergency room
we have definitely an increased space.
You got increased space.
Yes, but for the meantime, because we're only in phase 1,
Okay.
we're going to be going to phase 2, meaning we're renovating the existing ER. Then we're going to be operating with the same bed capacity for the meantime until the whole project is completed.
Oh, I see. So
Yeah.
right now, ER does not get any more beds, but you do get a little bit more space.
Definitely.
Now what will you do with the extra space? Why will that help you?
Well, definitely, as I said, more privacy for the patient, because right now, in between, there's only curtains. In the new ED, there will be really walls.
Oh, good.
Yeah, so we're going to be more compliant with the HIPAA, privacy.
Right.
Yeah,
I mean, if I'm having an
definitely.
emergency and I got a shower curtain between me and the next patient
Yes,
having an emergency,
definitely.
that's not going to make me feel any better. I guarantee
Yes.
that.
Yeah, but we can, even if you speak the minimum volume, you would
Really?
still, yeah.
If we were
But
saying really quietly, my leg is really hurting. The next person would hear it.
yeah,
Okay,
so
that's not
definitely
what I
in the new emergency department, then that would really help solve the problem.
How many people do you need per bed at the emergency department? I mean, I suppose it depends.
How many?
But
What?
yeah,
I'm sorry.
how many people do you need? How many personnel per patient?
Oh, right now, every shift, we're doing an 8-hour shift.
Mm-hmm.
That's our basic shift. So there's like 8 nurses, 2 or 3 ERTs, 1 ward clerk at a time.
Mm-hmm.
So that's going to be totaling to like 12
Okay.
with all the other responsibilities, not just taking care of patients, but carrying out other stuff.
I see. I
Yeah.
see. Now, with an expanded emergency room and more beds, how many beds are you, when phase 2 is finished, how many beds are you supposed to have total?
Because in the new emergency department, we have 2 trauma rooms.
2 trauma
Yeah,
rooms.
2 isolation rooms.
Right.
And then
We have a
12
drowning
monitored
and a
beds.
heart attack. What a great
Yeah,
night that would be.
definitely. And definitely a lot of bigger space, so we can be more efficient and more room for us to work on the patient. And also there's going to be 12 monitored beds. So as I said, right now we only have 8 monitored beds.
Okay.
And definitely the space, as I said. But when that is completed, then we're going to have more rooms for sure.
Okay. Well, I mean, that sounds like
More monitors, it's...
Well, when you talk about it, it sounds like you're something that you're really looking forward to.
Oh, definitely,
What do you think the
definitely.
best thing about the expanded ER is going to be, or the emergency department's going to be?
1 and 2, or just for 1 for now?
Just for one.
Just for 1, as I said, the space, and we have new
space.
equipment, new central monitoring system. We're expecting more equipment that the hospital, the emergency room doctors really need to help diagnose patients.
How big is this space now? I mean, could you give me
I
like
I can tell you twice. I don't really have the specs.
Yeah,
but
no, I
yeah,
mean,
about
put it in roughly.
twice as much.
Oh, it's going to be about twice as much.
Where
now.
the existing ED is.
Okay, is it-
Definitely, I would say at least twice as much.
Is it as big as, I don't know, right now, roughly the space as big as, like twice as big as somebody's floor plan in their house, or as big as a cafeteria?
That's bigger. That's more than 1,500 square feet.
Oh,
so
really?
Where we are right now, definitely it's about twice as big.
Okay, you really need that space. Well, thank you very much for kind of giving me an idea
Yeah.
of what is to come, and at least they have the additional space, and we'll be looking for. Well, I'm going to ask you some more questions about that, Suzanne, here in a minute. This is a good question. We've been talking with Suzanne Aquino. She's a registered nurse at the hospital, the Emergency Department Nursing Supervisor, and she's here with Marnette Aggabao. She's a nursing supervisor of ICU, and the big ribbon cutting that took place, most of the improvements at this point were at CCU and ICU. There were some space at the emergency department, but we want to find out what additional capabilities this is going to give them inside the hospital. So stick with us. My name is Travis Coffman. This is Good Question. We'll have more right after these.
Burn up the bandwidth. Guam's hottest talk comes to your smartphone with News Talk K57's streaming apps. The latest in news, weather, and talk in the palm of your hand. Plus, exclusive features let you talk back to us via email. Visit our webpage and see breaking news on PNC's Twitter page. Smartphone users can now download the free app, which will stream all day, every day, and anywhere. Look in your platform's app store for K57 and download it today.
Good evening. Welcome back to Good Question. I'm your host, Travis Coffman. We're talking about big improvements this month at Guam Memorial Hospital. You've heard the story of folks waiting in the hall, waiting to get a bed, even when their need is sometimes critical. And they need to be in ICU, they need to be at CCU, they need to be in the emergency department. There just wasn't enough space at the inn. Well, a lot of that is changing, some big changes, a big ribbon cutting, a big expansion, particularly at CCU. And we've got a couple of nursing supervisors with us this afternoon that have a lot of experience with the existing facilities. And Marnette is with us tonight from CCU and ICU. Now, Marnette, you worked there actually more than 20 years?
Yes, more than 20 years.
My gosh, okay.
Yes.
So it's got to be a pretty intense job at,
Yes, it
at
is.
ICU. I mean, it says intensive care, critical care.
Yes, it's a stressful job.
Now, but you've been there for so long, you must
Yes.
like it.
Yes, I do.
Now, they're making some big changes. From
Yes,
what to
we
what?
do.
Tell me basically what exists and what are they going to?
We used to have an 8-bed capacity, and now we're turning into 14-bed capacity for the intensive care. I can call it a state-of-the-art intensive care unit because all the equipments that we have are all brand new. We have bigger space to take care of our patient and move efficiently. We have, this consists of like 14 staff nurses, registered nurses that are well experienced. And then we have 4 monitor techs that watches our monitor, the cardiac monitor. And then we have 1 ward clerk that helps us just Monday to Friday. So those are the help that we have. And we have nursing assistant, just 1 for the unit.
Okay, now
Yes.
monitor techs.
Monitor techs. They monitor the heart and they're outside of the patient's room. So they're just sitting there watching for changes with the patient's heart rhythm, blood pressure, if it's dropping, or the patient is not breathing when they're not in life support.
Really, I had no idea there was
Yes.
someone there watching the whole time.
Yes, we have.
Oh, okay. Well, that's good to know because you want to know that somebody's watching the store in
Yes.
intensive care and critical
Yes.
care. So all of that equipment is new.
Yeah, it's all brand new.
Okay. Now, does it do things that our current equipment doesn't do, or just newer versions of it?
Well, it's just newer version that we have, but it's almost the same.
I'm sure there's not a typical day at CCU or ICU, but maybe you could tell me some of the kinds of cases that would often occur or often land somebody in ICU.
Yeah, we have patients that are in life support because of a lot of problems, like they have lung problems or they have heart attacks or they had a motor vehicular accident after ER, they come to us. We have patients whose blood pressure is very low, so we have to support the blood pressure with medications that cannot be used in other floors. It's only in the intensive care. We have patients that are suicidal patients, we have them. And as of now, we have 2 rooms that are for communicable disease or it is for infectious patients. We have 2 rooms for now. The last, the old CCU that we have only 1. So it's difficult because we have to put them on a regular bed, and it's not so safe.
For the rest of the patients.
For the rest of the patients,
See,
yeah. We have...
Just saying that makes me want to cough. You'll have to excuse me.
Yes, yes.
But I swear, I don't need to be put in my own room.
We have that. So it's, before it's just you go into the room, that's where the patient is. Now we have the ante room wherein you prepare yourself. It's another, like a small room. Prepare yourself before you get into the patient's room.
I see.
Yes.
Now, when you talk about the new facility,
Yes.
it seems to me that you're excited about it, that you're really happy with this new facility.
Yes, we are because of, the space that we're working, and we can accommodate like patients, from ER that needs to be monitored, and we can take the patients from up the floor that are waiting for an intensive care bed or a CCU bed. Because we have still patients that are waiting on, the regular bed to come down. So at least we can accommodate them now.
Well, that is great
Yes.
news.
Mm-hmm.
Now, you were both talking about you were going to need additional staff. With
Yes,
this
we
extra
do.
room, you've got more capabilities if you've got more people.
We get more people to work, yes.
How many more people?
As of now, we have like 14, and the plan would be like 40 to accommodate the 14 beds. We need like total of 40.
40, and you have how many now?
We have only like 14 with 9 part-timers.
Right. Oh,
Yes.
okay. Have they talked, has Mr. Verga talked about recruiting new nurses or bringing new people on?
Yes, that's why we're asking the public if there are nurses that are well experienced to work in the intensive care and the emergency room. we're open for application.
Well, of the people that I've talked to from GMH, and please don't put me in the communicable disease room because I keep coughing. It seems to me, I've met a lot of them with a lot of experience, that once you settle in at GMH, you generally have a good experience. Why have you stayed so long?
Well, there are, the problem also with the floors is that they would be recruiting. We have a lot of new nurses, new grads, but they cannot come down to the intensive care because we need experienced nurses to come down. The problem is we have new nurses up on the floor, but a lot of nurses leaves the island. So it's like replacement of those nurses that are leaving. Even for us, we would have new nurses that we orient to work with us, but then there are nurses that leaves also the unit to go off island. So that's a problem. Mm-hmm.
What kind of personality do you think would fit best in ICU, CCU, emergency?
It should be a well-experienced nurse. If they work in CCU for like 2 years, that's our optimum number of years of experience, we're open for that.
Okay.
Yes.
But I mean, as far as just your personality, I mean, people like to stay up late and drink coffee and are addicted to adrenaline. They love working in news and things like that. Do you have nurses that are addicted to drama, that want to come in and be part of something heroic every day? Is that part of your personality?
Well, for the emergency room, anything goes. We can't close emergency room because we're the only civilian hospital. So we have patients from birth to dying. So that's why it's really a good experience working there, because you get anything and everything. It's not like the hospitals in the States where it's only for children's, only for adults, only for maternity. We get everything.
Okay, so you just never know. Just no average day at the office when it comes to the emergency department.
Yeah. So as a nurse, I think you're never going to be bored because you constantly learn every day. We never stop learning still. Even if you've been there how many years, you still learn. You need to continue to learn because you need to grow as a nurse. You don't just get stuck in that. I just graduated, that's it. I
don't need to learn anything new. You're not going to get along well there.
Yeah, no, you need to learn every day.
What was like the last thing the new thing that you learned? You were like, I didn't know anything about that, and you picked it up. Something that you thought, or some new technique, or something new about a condition. You thought, okay, that one I didn't know about.
Nothing recently.
Nothing recently. It's
no,
been a while.
Yeah, nothing recently because it's about the same, like diabetic patients, high blood pressure, ESRD patients. So we have a lot. Well, I just been on admin for like about 2 months. So kind of been away from really constantly on the clinical area.
Oh,
but as I said...
well, then you learned about admin. What have you learned about admin?
Oh, definitely. It's a different challenge for me.
Right?
Different challenge. Of course, you have to deal with personnel.
Right.
Definitely.
Right. You can deal with life and death, the babies dying, but personnel, that's scary.
Yeah, definitely. For the clinical case, I mean, for me, I've been there 12 years. Just kind of routine, actually. So this is a different challenge for me, considering that, this is the first time I've tried it. I would say dealing with people is the hardest. I mean, as far as your staffing goes, especially that we're short also. Yeah, people, of course, we want to go recharge, we want to go on leave, but as I said, because of the shortage, that's like CCU.
You've got to take care of business.
Yeah,
so as far as, what do you think the biggest misconception is about nursing, particularly in CCU, ICU, or emergency? When people think about your jobs and they go, oh, it must be like this, and you're thinking, no, you're not even close.
Yeah. People think that ICU, everybody that comes in the ICU, they'll get better. That's what they're thinking. We have to give them good care and then they get better. But there are some things when, no matter how we try, it's up there, to help us out. But we tried our best.
And so I think that drives home the point more than anything, Marnette, that if we can make more resources available and more staff available, we'll have a better chance of helping those good outcomes? This is Good Question. My name is Travis Coffman. We've been talking with Suzanne Aquino and Marnette Aggabao, both from GMH. We're talking about the emergency department and ICU and expansion to both departments and what it's going to mean to the day-to-day operations. And we'll be back to wrap things up right after these.
I like that.
Yeah, I like that. You gotta like that.
What's not to like?
Like.
I like that.
Ooh, I like.
Oh, I definitely like that.
That too. I like that one.
I like it. Like, that's weird.
I like this. Yeah.
There's a whole lot of liking going on. That's right, we're too cool not to like. Like us on Facebook today. What do you like?
I like it.
I liked that yesterday.
Welcome back to Good Question. My name is Travis Coffman. I'm your host, and I've had the pleasure of speaking with two nursing supervisors tonight from GMH, one in charge of the emergency department, one in charge of CCU and ICU. And one of the things that we hear on talk radio all the time is that, oh, I had to wait 8 hours in the waiting room. And I've had it explained to me by other physicians that work. Look, it's not a first come, first served basis. It doesn't depend on how long you've been there. It depends on who needs the most attention first. If you're going to go into shock, if you're going to die, that bumps you right up to the front of the line. So if you're well enough to wait 8 hours, you're in better shape than most other people, yes?
Yes, definitely. There's a lot of patients because of other issues that come to the emergency room thinking it's an emergency for them, but actually we follow a certain protocol. It's not as you said, a first come, first serve. It's who needs the most and immediate care first.
Right. If you're having a heart attack, you win.
Definitely.
Yeah, if there's something else not worse.
Yeah.
Now, and we've had doctors say a lot of these things can be taken care of outside of the emergency room.
In a clinic.
And should have, but that's the case. Now, as we were headed into the break, you were telling us about the fact that people come to the hospital hoping no matter what, against all the odds, people are going to get better. And you were telling me that often that's not the case.
Yes.
But will this new emergency, new ICU room help you in your quest to provide quality health care? Because you were telling me as we went into the break that people think, oh, bad things are going to happen to the hospital, but you seem very confident in your ability to provide good service at GMH. Marnette?
Yes, if only our community, will come to the hospital when they're sick, or they have to see their attending physician outside, their own private doctors outside. Not wait for the last minute and then go to the hospital. They should have always like a monthly checkup, most especially when you have these conditions that needs to be monitored. The hospital is always there, but if you're just coming in for a flu, come please see your doctor outside, because we're already like swamped with very, very sick patients in the hospital.
But
yes.
Should that be the case, no matter what the case, you're going to do the best you can
we will.
To get them back to health. Ladies, I could talk about this all night and ask you questions all night, and I thank you for being here this evening on Good Question. Once again, I'd like to thank Suzanne Aquino and Marnette Aggabao, our guests, our registered nurses, our experts. And now, if for whatever reason you or your loved one happens to find yourself in the emergency room or ICU, they probably still will be very busy and won't have time to talk to you except to check your vitals. But you'll know who they are and that they're friendly, hardworking people, just some of the many people that are working to help save lives here on Guam. Thanks so much for watching. Thanks, ladies, for coming by. I very much appreciate it. This has been another edition of Good Question. I'm your host, Travis Coffman. Thanks for listening.